Welcome back to another video. If you're new to the channel, I am Rio. Today we're going to be looking at my 4-month update versus a 4.5-month update with a haircut. The 4-month is on the left, as you can see, and the post haircut is on the right. A lot of you have requested to see, or more so left comments wondering what the donor area would look like when I cut my hair. So I figured I would just make this video to give you guys an idea of what that looks like, kind of just give you the same kind of side-by-side rotation so you can get an idea of what I was able to accomplish when I cut it. In the video, I'm also going to give you some other looks and some more insight for some things I've been trying. And here is a look at the top of the head. Enjoy the video. I am approaching 5 months. Today is November 7th, so in about a week and a half, somewhere around there, I'll be at 5 months. I wanted to make this video to show you pretty much what the difference is from where my hair was at, a little after 4 months to about 2 weeks later to where it is after I cut my hair. I cut my hair Friday night and today is Sunday. So it's been, a little over a day, almost 2 days since I cut it. I took a shower not too long ago and I really haven't done nothing to my hair since I showered. I didn't brush it, I didn't comb it. I wanted to show you the, best, truest state or truest form of what it would look like without me doing anything to it. Fresh out of the shower, I didn't put lotion on my face or anything, so I'm like kind of dry showing you this. But you can get a good gauge and idea for what it looks like. I have a brush and a comb. I'm gonna brush it and comb it so you can kind of see usually what I see daily when I am brushing or combing it, of course. Looking at it, you can kind of see there are some areas where there are some thinning. I think that's fair, seeing that I'm only approaching 5 months. There's still a good, 7 months left, as some people would say. I did see some comments where people said, they thought the donor looked fine, and as long as I cut my hair or wear a fade, I'd be fine. That's not really my goal. I don't really want to always have to keep my hair cut to look normal in the back. Only receiving 3,000 grafts, I feel that, I really shouldn't have to do that. I also did mention in that video where I kind of revealed what the hair looked like that I did have some ideas for the donor area. Since then, on 2 separate occasions, I've used microneedling, or I use a microneedle to microneedle the back to basically get some generation of blood flow kind of going to that area. I guess really like more so heal the scar tissue back there. Because I think once you're able to heal the scar tissue, you can kind of get stronger hair follicles. I'm not a medical professional, but based off the research that I've done, that's usually what they say. So I've done it twice. I've been doing it once a week on Sundays, so I'm gonna do it again today, being that today is Sunday. I really feel as though in the past 2 weeks since I've done that, I've seen some positive results. Does it all come down to that? I really don't know, and I can't say that it does because I don't know. But by doing that, I have seen some good results. So I'll just leave it at that. And I'll continue doing that to see what comes out of it. But so far, you can kind of see what the donor area looks like. I will kind of show you my crown as well. I didn't have any grafts put there, but I have been doing as many preventative measures as far as like medicines and things like that, which I'll talk about in another video. I have, seen some comments where people ask if I'm taking finasteride or minoxidil. I made a video, I'll put it up here in the cards, right there. I made a video about my hair transplant journey before going to Turkey, and I would encourage you guys to watch that so you can kind of see what my, what my progress and everything that I went through with my hair since I was a teenager when I first started thinning. So check that out. You'll kind of learn more about my first transplant, being that this was my second. You guys will learn more about that there. But anyway, let me grab my brush and my comb. So this is the comb I've been using. It's a wooden comb from Amazon. For those of you that are interested, I will link it down below in the description section. And I'll also link down below the microneedles that I've been using. I bought a pack from Amazon. I'll link that down below for you guys as well. Again, I showered and haven't done nothing to it. It's the first thing I'm doing to it. And by doing this, you can kind of see, now that the hair kind of lays a little more straight, you can kind of see where some of that thinning still is. And again, I think this is fairly normal for 4.5, approaching 5 months. Now I do have one area here. If you saw, the video where I talked about my experience with the clinic, I talked about, each day of kind of the things that I went through, some of the troubles that I encountered. I had an infection that they were telling me in the clinic that they were trying to prevent, but I feel as though that they knew I had an infection. They just didn't want to tell me. But when I got home, I found out I did have an infection. Right here, I have an area, you can kind of see when I kind of pull it back there. I have an area where I can't tell if there's hair actually growing there. And I also don't know if that's where the infection was located. I'm not entirely sure, but as you can see, if I comb it forward, you're not able to notice it as much. However, it would suck to go through a full term of 12 to 15 months and not have any growth there at all. I think it may be able to be mask and disguise when the hair grows out, but that's not the goal there. So just gotta wait and see what happens with that area in that situation. But what I've been doing is kind of like, you know, pulling the hair back when I comb it, right at the hairline, so the hairline does look profound. When I cut my hair, I only really line up the sides here. I don't line up the hairline because of course there is transplanted hair that's there, so I wouldn't really have to, but that's what that looks like. Now I'm gonna use the brush to brush the back of the donut area and then show you the crown afterwards. Here's my brush. I've had this brush for, I don't know, 10, 15 years, probably too long. You can see here, brushing the back there. I mean, as you can see, based off the haircut that I gave myself, I was able to really blend in that donut area from the non-harvested to the harvested area. And even though, you know, I did have the issues, I think things are going well. I would have liked to be further along with the donut area being approaching 5 months, but things doesn't work the same way. Things doesn't happen in the same rate for every person. So maybe I'm just one of those people that's gonna take a little bit longer to heal up back there. But like I said, the microneedling has been helping. And I think in time, my donut area will look like nothing was ever taken from it. And that was the ultimate goal for me. That's why I didn't want to go over 3,000 grafts at all. And really, I didn't need to. I don't brush the top too often. I usually comb it more, especially at this length, I comb it more than I brush it. But you can kind of see what that area looks like there. Now I'm gonna show you the crowns, kind of get some of that hair going the direction it's supposed to. That's kind of what the haircut looks like. Let me give you another spin now that I've combed it and brushed it, so you can kind of see what it looks like now that I've done that. So this is straight on. So we have the left side here. This is the back. And then this is the right side. And now let me show you the crown. I'm gonna put some pictures up of what my hair looked like before I got the transplant. Here are a couple pictures that I actually sent to the clinic when I initially reached out to them back in February. I sent somewhere around 4 pictures. The first one I sent was this one right here. And as you can see, where my trouble areas were, or my main focus was my corners and then lower my hairline. However, you can kind of see where I put these red circles. Right in this first red circle, you can kind of see I didn't have a whole lot of density in that area. And then of course my crown, but I knew that I could work on those. I didn't want to really put grafts in that area. The crown I would have liked to, but I know the crown eats up a lot of grafts, or you need a lot of grafts to actually cover the crown. But I knew that I can attack those in other ways. And in this picture, I actually combed the hair backwards to get a better look at where the problem areas were, where the thin areas were. Even though I only had grafts placed in the corner and then around the hairline, I can say that I have came a long way with all of the things I've been doing to really grow and strengthen the rest of that hair. And again, I'm gonna make a video and really talk about all the things I've been trying and all the things I've been taking to give you guys an understanding of what I've been able to do with the hair growth outside of the hair transplant. And might I also add that these pictures are from February, and I didn't end up going to Turkey until June. From these pictures and in the 4 months that it took me to actually go to Turkey, my hair ended up looking much better before I went because I started implementing some of the things I knew I would be doing after the transplant. I didn't have any grafts transplanted here, of course. I only got the grafts in the hairline and in the corners. So here I did have some thinning, but I have been taking medications, which I think has helped. 5 months out, I'm gonna keep doing what I've been doing. I'm gonna keep doing the microneedling every Sunday. We're gonna see what happens. But this was just a really quick update for you guys because I'm sure some of you were wondering and I wanted to answer a few questions. And hopefully this video did do it for you. When I microneedle tonight, I'm gonna show you exactly how I do that for those of you that are wondering. So stay tuned for that. It's actually about a week later. I did use the Demerilla last week, but I just never had time to film it for you guys. So I'm gonna be walking you through exactly how I do it today. Now, the derma rollers that I'm gonna be using is these right here. As I mentioned, I will link them down below. I got it from Amazon, so you can check that out. Now, it's a forgot to mention this. It's a 3-pack set. And you can see here it has, well, I gotta see it. It has a 0.5 millimeter, 1 millimeter, and a 1.5 millimeter. The one I am gonna be using is the 1 millimeter. Looks like this. You can see that. And it has 540 needles on it. There are other types that you can use. And of course, feel free to use whatever works best for you. You know, I'm just giving these a shot, see how they work. The 1 millimeter is what I'm working with now. And then when I feel like this is not really enough anymore, I can then jump up to the 1.5. So I will link them down below for anybody that's interested. So check those out. So essentially the area I'm going to use this on, or what I've been using it on, is the whole donor mapping area, and then right on the center part of the crown area. You can see that through the mirror there. So that's what I'm going to be using this on. I will be doing this for somewhere between 3 to 5 minutes. It just depends. Sometimes it's a little bit closer to 5, sometimes it's closer to 3. So we're just going to see how this goes. So I'm just going to set a timer. I'm going to use a 3-minute timer, and then of course I'll do it for that amount of time. Alexa, set a 3-minute timer.
3 minutes, starting now.
Let's get to it. Hopefully you can see through the mirror there. But I just press hard enough and I just slowly roll. Some areas are a little more sensitive than others. You know, just use a mirror so I can see. I'm actually gonna time lapse this so you guys don't have to sit through this whole time of me doing it, but you'll get a good gauge and a good idea of what I actually do when I do it. So, see you when I'm done. I can see the skin getting a little bit red, which I think is good. It's kind of what we want. Alexa, stop the timer. I should have set a 5-minute because I'm finishing up the donor area, but I still got to do the crown. So I'm going to add another 2 minutes and then finish up then. Alexa, set a 2-minute timer.
2 minutes, starting now.
Alexa, stop timer. Last week I didn't do my crown and I got some blood in this area, which is good. That's actually good. So I'm gonna go over the donor area one more time and then I'll finish. Now that I'm done with it, I'm gonna soak it in some rubbing alcohol. That concludes this update video. The next video that I'll most likely do with the hair transplant will be me sitting down and actually talking about why I chose the clinic in Turkey that I went to, give you a little more insight that what went through my mind and why I chose not to do it where I got my first transplant done, which was Bosley, and why I didn't choose any other clinic here in the States. But anyway, I'll talk about that in that video. Hopefully you guys enjoyed this update video. Hopefully some of you found this helpful. I got some fashion videos coming up as well, so hopefully you guys will check this out. Anyway, that does it for this. I'm gonna catch you guys on the next video. Peace.